Hi everyone. It's so good to see you again. Thank you for joining in. So you're welcome to Mental Health Talk with Evelyn. Yeah, so this is Mental Health Talk with Evelyn. You're welcome. Yes, today I have here with me, as you all know, my name is Evelyn, and I have here with me, Belema. So Belema, you're welcome. I know you've been on Mental Health Talk with Evelyn before, and this is your second time of joining. Belema is actually my co-host, and she'll be hosting it sometimes from time to time, even when I'm not around. So, but hey, it's still Mental Health Talk with Evelyn, purposely for mental health awareness. Yeah. So okay, so today we are going to be talking about postpartum depression in women. So just like on the flyer, so if you've seen the flyer before, it's on postpartum depression. So, and our focus is on women. But before I start, just a brief introduction of mental health opportunity. So this program is brought to you by Grace Hill Behavioral Health Services, a mental health and drug rehab facility here in the heart of Lagos, and of course supported by the Grace Hill Healthy Mind Initiative. So the Grace Hill Healthy Mind Initiative is the NGO arm of Grace Hill Behavioral Health Services, solely for teen drug awareness and anything that has to do with a teenager, substance abuse, mental health awareness, and the rest of it. Just colors we are in. So today this is Mental Health Talk with Evelyn. So this program is being held every Wednesday by 3 p.m. every Wednesday. So we talk basically on mental health education, all you need to know about mental health, everything you need to know about mental health. So if you want to learn more about mental health, type of disorders, anything, this program is for you. Yeah, so like I said, today we will be talking about postpartum depression. So before now, I've on our previous sections, I've talked about depression in children. I also talked about postpartum depression in men. So actually, some people do not believe that men could also go through postpartum depression. Hey, but the truth is, men also go through postpartum depression. But our main focus today is on on women, right? So we are going to be, as time goes on, you will understand better on what postpartum depression is. So briefly on the definition of postpartum depression. So you can watch our previous videos, yeah. So like I talked about postpartum depression in men. So you can go to our YouTube channel to watch that particular session at Grace Hill Behavioral Health Services. So when you go to YouTube, Grace Hill Behavioral Health Services, you'll see my previous videos, even the one I talked on postpartum depression in men. You're going to see it there.
Okay, so now we'll just start. Like Evelyn said, we'll be talking about postpartum depression in women. So as we go on, sometimes we'll say PPD. That's just
it's just a short form of
postpartum depression. So just in case you are saying PPD, you don't get it mixed up. So we are going to start first by defining what postpartum depression is. Well, the definition of postpartum definition is that it's a mix of behavioral, physical, and emotional changes that happens in some women after giving birth. Okay. So it is usually linked to chemical, social, and physiological changes that happens when having a baby or after you've had a baby. So now, I know for some people that have been with women that have just given birth, you notice that some of them are usually sad, be it emotional, kind of depressed, stressed up, anxiety, and all that. Now that is not postpartum depression, really. That is called baby blues.
So we should be able to differentiate between baby blues and postpartum depression, also known as PPD.
Yeah. So a lot of mothers actually experience baby blues. Now the difference between baby blues and postpartum depression is that baby blues just last for a shorter period, short time. Let's say within like 2 weeks, it's over. Get so when you feel like you can say it is postpartum depression, it must have happened or it must have been happening consistently over 2 weeks. You understand? And then for baby blues, the symptoms just resolve themselves on their own. You don't need treatment, you don't need therapy, you don't need anything. After a while, they just go on their own. Better. But that's different for postpartum depression. Postpartum depression is more intense. So when you're having baby blues and you're feeling sad and you're feeling anxious, you're feeling stressed and all that, postpartum depression is more intense than that. It's more intense, it's more severe, and it lasts longer.
So out of like 4 out of 5 new mothers experience baby blues.
Oh yeah.
So it's not like you are alone on it. So even if you are a new mom and you experience baby blues, it's
a normal thing.
Yeah, it's a normal thing, right? So you don't have to be scared for anything. But it actually needs more attention when that feeling has exceeded a period of 2 weeks. So we'll be talking about the causes of postpartum depression. But really, there is actually no known causes of postpartum depression. But however, there are risk factors. So there are some risk factors that could or that may contribute to postpartum depression. So postpartum depression may be triggered by a combination of both physical and emotional stressors, just like she mentioned earlier on. So we'll be talking about the physical changes or the physical factors and the emotional factors in this session.
Okay, yes. So, well, the physical factors, risk factors for postpartum depression. For people that may not know, risk factors are things that can increase your chance of having something. So if you're talking about risk factors of postpartum depression, things that can increase your chances of having postpartum depression. Remember that we said there is no known cause for postpartum depression. So all these things will just increase the chances that you can develop postpartum depression. Now, the number one or the biggest physical change that happens or that leads to postpartum depression is hormonal imbalance. The thing is that when a woman is pregnant, so the levels of our hormones, especially estrogen, progesterone, it increases.
Yeah.
You get. But after she has given birth, there's a sudden drop in the hormonal level, and this can now cause depression. So the sudden change in the hormonal level, that's hormonal imbalance, the change in the hormonal level can actually lead to depression, and this is like the biggest factor that leads to PPD. Now, other factors include sleep deprivation. If you're not able to sleep, if you're not sleeping very well, it can lead to depression, and then PPD, because actually sleep deprivation leads to depression. Yeah. So it also leads
on a normal
to
day when I'm not sleeping. So even if I'm not a new mom, on a normal day when I'm not sleeping, like I've not slept for like maybe 2 to 3 days, all of a sudden I just become so irritable and beginning to get depressed. So talk more of you being a new mom with the whole stress of the new baby, cry and everything.
Yeah. So also inadequate diet. If you're not eating very well, if you're not eating good food, it can be a risk factor, it can be a contributor to postpartum depression. So that's why they always talk about, not just why, but partly, they always say new mothers, your food should be nutritious,
Yeah.
You should eat good
well.
food. You should eat good food. Because if you don't eat good food, it could lead you to PPD, even while you're pregnant and after you've given birth. So you need to eat good food. Your diet has to be adequate for...
Very adequate.
And then also, if you have some underlying medical conditions, underlying medical conditions can lead to PPD. If you have a history of drug and alcohol misuse before you even got pregnant, it can increase your chances of having PPD. So it's not just about stopping while you're pregnant. If you have a history, if you've been misusing drugs, misusing alcohol before you got pregnant, or for a very long time, it could increase your chance of having PPD. After delivery.
Okay, so I'll briefly talk on the emotional factors of risk factors of developing PPD, even as a new mom. So you may actually be more likely to develop postpartum depression if you've had a previous mood disorder in the past, or maybe in your family. So before now, during one of my sessions, I've talked about the causes of mental illness, and it is a known fact that it is hereditary. So you can have a family of 4, 5, and you discover that 3 out of the 5 persons in the family have mental illness. So it is hereditary. It runs in the family. So it is actually a known fact. Then other emotional stressors that could or that may position a new mom to be at risk of developing PPD includes recent divorce or death of a loved one. So normally, if you lose someone, you are depressed on a normal day. You get sad, and if not, taken care of, it might lead to depression. Then you or your child having serious health problems. So I've actually know of someone was telling me about a friend or a family member thereof. This person actually has 3 children, and 3 of the children are autistic. So imagine the lady expecting a 4th child. So that thought or that notion of, oh, okay, will this my 4th child be autistic? And mind you, some children are autistic, and even when they give birth to the child, the parents wouldn't know until a certain age. That's when they begin to, manifest the symptoms of autism in that child. Right? So we are not talking about autism today, maybe subsequently. But when a new mom, you've had previous experiences of, health defects or serious health issues among your other children, because of that fear of having, this your present child, of having that child to get in line with that sort of sickness or whatever it is, there's a risk of developing PPD. Yeah. Then another one is social isolation. So I don't, maybe it's me or something, but I actually have problem with young people, or would I say young married people, having this notion, or maybe it's what has been instilled in them. So when someone just got married newly or something, then they tell you, oh, don't tell anybody your problem, don't discuss your problem with anybody. So it's just between you, your husband, and God.
Sometimes it's experience, though.
I'm not arguing the fact that it's experience, but hey, it's not everybody that is bad. Come on. So if you have any issue at all, it is best you have a friend or you have someone that you should be able to talk about it. And of course, you screen the person you are talking about. You should be very careful, though. I'm not saying you should go about telling people about your problems and all. It's not everybody that is genuinely happy for you, yeah. But then you still have to talk to someone about it. So you keeping it all by yourself, because of that notion that I don't discuss my family issues with people outside, you end up dying in silence. And that is the truth.
Yeah, well, the thing is, for some people, to an extent, we understand why people may not want to share their issues, their problems, but at the end of the day, you should have someone that you can speak to when you're going through things. Because when you have a problem and you can't speak to someone, it makes the burden is more on you. It makes it heavier for you. You should have people that you should be able to share your problems with. Oh, this is what I'm going through. And the truth is, if you don't share your problems, it's difficult to find solution.
Very true.
Whatever you're going through as a new mom, some people have gone through it. But if you don't tell people, oh, this is what I'm going through, they won't be able to tell you, oh, this is how I coped. This is how I managed this. This is how I was helped. So you need to tell somebody that you trust. You need to find ways to, relate with people. You don't have to isolate yourself because of whatever you're going through.
And I think that is one of the lead cause, aside from the hormonal changes. It's one of, for me, right, it's one of the lead cause of PPD, because people tend to keep to themselves too much and they don't share their problem, right? So it's a risk factor, rather. It's a risk factor. Then financial burdens. Everyone knows that the birth of a child comes with a lot of responsibilities. Yeah, so it comes with a lot of financial responsibilities. You have to buy this, you have to buy that, buy a lot of things for the child, and just ensure that you are very okay, and the child is also okay. So, but when that finance is not there, when that adequate amenities are not there, there is actually the person might even fall into depression. Okay, so lack of support, yes. So when you don't get a lot of support from people, you expect to get support from. There is risk of developing PPD. So imagine a new mom expecting to be loved and supported by the husband or the partner, let's just say for single mothers now, and they're not getting that love and support. So of course they would fall into depression, because like the whole workload is on them.
Yeah, and I saw somewhere somebody was saying something like they would like to do a study. I read somewhere the person was saying they would like to people to probably do a research to see how the Omugo culture that we do, how it's affect depression, PPD, and all that. And as a matter of fact, this is where the support comes. So when you have somebody that you're comfortable with, like your mom, coming to help you after you've given birth, it relieves stress for you. It helps you to be able to function better compared to if we're doing all these things alone. The support is actually very important.
Very, very, very important in overcoming.
You don't need to isolate yourself. You need somebody to be your backbone. You can't do it alone, really. You may be able to do it alone, but if somebody else can help you, it's better for you.
Yeah. So another one is, conflict. Some people actually do not know how to resolve conflicts, especially in their relationships. So you being, you are always having issues with your partner or whoever it is that is in charge of you or you are staying with and all that. And as a new mom, you need some level of support, like we just mentioned. So if you are always having conflict, you are at risk of developing PPD. Then of course, stressful life effects. So there are actually a lot of risk factors, which we possibly cannot even mention everything. So if we start talking, so this topic is actually a very broad topic. It's something that we cannot even finish. So, but it's actually for the purpose of awareness, because we discovered that so many persons do not actually believe that PPD exists.
Yes.
When I mean PPD, I mean postpartum depression. They actually do not believe that PPD exists. Depression is real itself. Then postpartum depression is also real. So when there's stressful life events, like I mentioned, previous history of depression, family history of depression, difficulty getting pregnant. So someone that is trying to get pregnant for a while, and the person finally gets pregnant, that child will be like the savior. So imagine someone looking for a child for over 25 years and finally gets pregnant and gives birth to that child. The person would want to make sure that the child do everything within his or her power to make sure that the child is really, really very comfortable. And also, it's actually a whole lot. It's really, really a whole lot. So we may not be able to list out all the risk factors because of time, but hey, I'm sure you are able to get the message and, of course, share the message.
So now we'll just move on to the symptoms of PPD. Now, like we said earlier, it is normal for a new mom to feel sad, to feel depressed, to feel moody after having a baby. But that goes away after a short period of time.
That's baby blues.
So that's baby blues. It's different from depression, which we said it's more severe and can interfere with your daily life. You understand? Yeah. So some symptoms of depression, and also something else to note is that it varies from person to person. So person A can have these certain symptoms, and person B will have a different whole set of symptoms entirely. So you don't say, because this person had the same symptoms and
you are having it, that means
you're having it. It varies from person to person. So these are some of the things that you just need to watch out for. And it's not just for a single mom. You understand? You can do these things by yourself. You can have kind of self-awareness to know that something is wrong with me. But it also helps that people around you should be able to observe that there's something wrong with this person. You understand? Like we said, support is important. I may be feeling this way, I may be doing all this, and I may not be aware that this is how I'm acting or this is how I'm behaving. But somebody else can point out to me that, have you noticed what you're doing? And then I'll come to the realization and then feel like I need to seek help and all that. So this is not just for single moms, it's for people around. Again, so when you see a loved one, you see a relative, you see somebody that you know going through this, you can chip in, advise the person to probably seek help. Definitely seek help, actually. So I'm going to move on to some of the symptoms. So number one, you feel sad. You feel very, very depressed. I don't use depressed. You feel sad. You're always crying, and you don't know why. Yes,
for no reason. You just stay and start crying.
You're just sad. You get, and then you're like, okay, why are you crying? And you really don't know. Not just because you don't want to tell the person. You really, really don't know. So that is a symptom of PPD. Then also you're exhausted but can't sleep. You're exhausted and you can't sleep, and for some people, you sleep too much. You just want to sleep. You don't want to do anything other than sleep. It's just like It's just like you're trying to run away from reality. So I just want to sleep and sleep and sleep and sleep. While for others, they're tired but they can't sleep. You see what I'm saying? The symptoms vary from person to person. It won't be the same in every person.
Everybody.
Also, you can't stop eating. You're not interested in food. The symptom that you're having PPD, or you don't even want to eat.
So it may be. So if actually this happens for a very long period of time, like we keep on emphasizing for like over 2 weeks, then you actually need to seek help.
Yes, you need to seek professional help. Then maybe you have various unexplained pains, illnesses. No, my chest is paining me.
Just to get attention.
Yeah, not necessarily. That's how you feel, really.
Okay.
But
some people actually do it just to get attention.
But then that's not PPD now.
But that's
It's just normal.
Attention seeking. Sometimes I feel like because you want attention from people you know. But something like that.
That's different. Yeah, but you just have some kind of unexplained illnesses or pains and all that.
Yeah.
And it's like you said, it has lasted consistently over a period of 2 weeks. So you're irritable, you're anxious, you're angry. Again, you don't know why.
You don't know why.
You're just angry. You're like everything someone is doing close to you is irritating you. It's annoying you. You have sudden mood swings. Now, this minute you're happy, next minute you're sad, next minute you're angry, the other minute you're, it's just up and down. You feel out of control. You can't really control things. It's like everything is just, happening at once, and you can't control it, and you feel so overwhelmed. You get. So these are some of the symptoms that you can see from somebody suffering from PPD.
Then again, so you might also have difficulty in remembering things. So it's probably an event that just happened, and you're asked to record and you've forgotten. Just now, like there will be like something that just happened now, and you've forgotten. So it's actually probably a sign to look out for. Then you have difficulty in concentrating and making simple decisions. So something as simple as your child poops somewhere or poops on his body. On a normal day, it's for you to just pick up that child and clean up that child. But because you lack concentration and sometimes you don't even know what to do, you just leave that child like that, and it's actually a symptom. It's like we said, it's actually not peculiar to some people. So it varies in different individuals. Then you have no interest in things you used to enjoy. So you like singing, you like playing basketball, you like playing table tennis, you like going out. All of a sudden you just become so reserved. You don't want to do things that you enjoy doing before now. It's a symptom. Then also you feel disconnected from your baby and wonder why you're not filled with joy like you ought to be. So ideally, motherhood or the birth of a new baby, it's supposed to be a moment of joy. It's supposed to bring joy to both parents, both the mother and the father. But when it comes to PPD, the feeling is actually mixed, right? So it is mixed. You really cannot tell if you are happy or not having the child. So at some point you feel like, why am I even having this child? You are not happy having that child. It's actually something to look out for.
Yes. Actually, I remember there was a time before I knew what PPD was. Before I knew what PPD was, postpartum depression was.
Yeah.
So someone was telling us about their relative that just had a child, and then the woman, she just didn't want to carry the baby. She didn't want to touch the baby. Like, she didn't even want to see the child. She didn't want to nurse. She didn't want to breastfeed. They literally had to beg her, to pump milk and all that. Sometimes they just had to buy formula and all that. So when the person was telling us this story, as at then, like I said, I didn't know what PPD was, and all of us there didn't know what it was, So it was we just felt like, why would a new mother behave like that to her child? This woman this woman is a wicked woman. If you know you don't want to have a child, why would you go and give birth? Why did you get pregnant? If you know you don't want to take care of a child, why would you get pregnant? Who do you want to take care of a child? We just had so many opinions, so many judgmental things to say about the person, and we didn't really have the backstory. We didn't understand what PPD is. But now, after I became aware of what PPD was, I thought back to that moment, and I'm like, this is probably what this person was going through.
Yeah. Because
I don't feel it's not something that you would want to imagine that someone carry a child for 9 months and give birth to the child and not want to see the child, not want to care for the child. It's something that you can't really imagine. But this is what happens when you have PPD. When a woman has PPD, she just feels disconnected. She's not happy. The way a nursing mother feels, even for people that didn't even carry the child, they're happy that they are happy that they are carrying child. And then you're seeing the person that has the child not feeling happy, and this is probably somebody that was so excited before getting pregnant and even during the pregnancy, and immediately they give birth, just a full disconnect. So yeah, this is one very important symptom to don't say the person is a witch. Don't say it's witchcraft. It is not. It is really, it is not. There's a scientific explanation for it. It is not witchcraft, please.
Yeah. So and again, so everything feels overwhelming and hopeless. So you just get tired of everything. The baby there is crying there. You are, especially those that have other children, you know, and you still have a baby to take care of. So the baby is crying, this one is shouting, turning the house upside. Everything just seems overwhelming and hopeless. Yeah?
Yeah, and sometimes you begin to feel guilty and worthless. You know, imagine having a child and you don't feel like taking care of your child, you don't feel like carrying your child. You don't want to do it, but you still feel guilty about why you're not doing it. You feel worthless. You feel like, oh, I'm not a good mother. Oh, I'm a bad mother. Oh, other people are doing motherhood better than I am. You know, you feel
and that could even lead to suicide. You know, that feeling of
depression
or worthlessness.
Suicide. So it's quite possible. That is why it is very important to seek treatment as soon as possible. And then when you now have these feelings, you may not be able to open up to people because you already feel like you're a bad mother. So you feel like these people will think that you're a bad mother, or they may take your baby away and all that. You know, it's not easy to tell people, especially for someone that is not aware or ignorant about things like this, that I don't feel like holding my child. Imagine the reaction you get. So when, for instance,
on a normal day, if it's okay, say I really don't know anything about PPD.
Yeah.
And someone comes to tell me that I don't feel like having my child. I don't feel like having. I will be like,
you know.
Okay.
And
so what is wrong with you? So why did you even have the child if you can't take care of the child?
So when you get that response, you know, and you don't feel support, it can even lead you to now begin to isolate yourself, and it can make the feelings of depression to now, you know, it can increase the chances of, you know, it can make it worse. It can worsen the case.
Could even lead to psychosis.
Exactly. So you feel like you can't open up to anyone as a nursing mother. You feel like you can't open up to anyone. You now begin to seclude yourself, isolate yourself. You don't want to speak to anybody. You don't want to come out of your room. That is actually very important. You see, they lock their rooms. They don't want to come out. They don't want to talk to anybody. Nothing. That is a very important symptom to watch out for. You know, you feel like you want to escape from everything and everyone. Like you don't want to have anything to do with reality. Everybody should just be on their own while you're on your own. You don't want to speak to anybody. You don't want to talk to anybody. You don't want anybody to speak to you. You don't want anybody to talk to you. Just, you know, locked up somewhere. And then also, for some people, they begin to have intrusive thoughts about harming themselves or their baby.
Yeah.
And it's not easy to talk about things like this. You know? Yeah. Imagine feeling like, maybe intrusive thoughts could be that, oh, I feel like I may accidentally hurt this child. So you carry your baby and you're like, oh, I may slip and this baby will fall. And so it may even lead to some kind of compulsive actions. You have to just pick up this thing and all this. Just because you have so many thoughts in your head telling you, oh, you're going to use this knife on this child. You're going to use this on this child.
I think, okay, so during that NSAS period, you know, it was really, really a very touching one for everybody. So during that period, I was discussing with a colleague, and the person was like, okay, they actually had a lot of calls and all that. So there was actually this person that called in, and the person was like, oh, I'm really suffering from PPD, I just gave birth. And she was actually having this compulsive thought of actually killing the child. So it is that real to that extent. Yes, so they had to look for a way to help this person, right? By referring the person to a trained counselor and psychologist that can actually help. And of course, the person should also have to seek medical attention by talking to a medical doctor in that field. Something as simple as talking to a psychiatrist. So I think, personally, I think people have this stereotype in their head that once you are being referred to a psychiatrist, you are something, it's it's beyond control. But hey, it's psychiatrists, they're actually specialists, so they can help you go through some kind of mental disorder. So this is a mental disorder that actually needs psychological evaluation and of course medication. So if you are going through PPD and you are being referred by your general doctor, right? Okay, by your doctor to see a psychiatrist or a psychologist, that doesn't mean you've lost it automatically, totally. What they are simply trying to tell you is go and get help from a specialized professional. So when you meet a psychiatrist, so a psychiatrist would probably prescribe some medication, and also we have other specialists in that field. Of course, we'll be doing a part 2 of this program. So I would implore you to watch your screen. So we'll be having other professionals to come and talk on this topic.
Yeah, and I also want to say something. So if you're maybe a mother that's passing through this, you don't feel like you have done something wrong, or maybe it's your fault and all that for whatever is happening. It's really not your fault. Like I said, there has been a lot of research about this, and the researchers have not been able to find a known cause for PPD. So it's not something that you can really control.
We just have risk factors.
Yes, it just happens. You understand? So once you begin to notice these symptoms, all you need to do is seek help. First of all, you can speak to people. You can also speak to other mothers out there. There are a lot of mommy groups here and there, support groups and all that.
Share your problem with them.
Share your problems. The truth is that, some of us, we tend to want to hide our issues, because for some reason we probably feel that maybe we feel guilty that we've done something wrong. Imagine, it's not something easy now telling somebody that, oh, I'm struggling with motherhood, and this person is doing, I keep saying, he's doing motherhood perfectly. It's not easy. You look at this person is just amazing, and you feel like, why am I not? What have I done wrong? What am I doing?
Why can't I be like this person?
So exactly. So you feel the need to keep your problems to yourself, and maybe put up a brave face, but you really can't put up the brave face for so long. It is very important to seek treatment early.
Yeah.
It is very, very important to seek treatment early. When you seek treatment early, to help you to manage it in a better way.
Yes. So some of those treatment options includes psychotherapy and medication. So there are some medications that could be prescribed for you to help you fight that depression. Yeah, so you could take some medication. Let's leave it at that. Some medication. Then you can also see a therapist as well. So therapy has been known to be very, very effective. So when you talk to a psychotherapist, a clinical psychologist, they will definitely help you go through the process of healing. Yeah, they will help you go through the process of healing. So do you have any other things to say?
Well, we've said a lot of things, and also, like she said, we would have a doctor come in to throw more light on what we've discussed. Give a more scientific explanation to some of the things that we've talked about here. But one thing that is important that we've said, and I'm going to say again, is that PPD happens to a lot of women.
A lot.
It is not
more
unique,
than you imagine.
More than you know. In fact, I think I saw statistics. I don't know. I'm not sure. I think it said 13% of women or something. I think, or 1 out of 10 women suffer from PPD, something like that in that line. So imagine, it's not something that is unique to you. It's not something that you have caused. It's something that happens.
It's a known disorder.
Exactly. So when you're going through this, when you see somebody going through this is also very important. When you see somebody going through things like this, something like this, don't say the person is a witch, because I remember that was the opinion that some of us had when we first heard of a woman acting this way after childbirth. Don't say the person is a witch, don't say the person is a bad mother. You know, a lot of things that we just see, we tend to judge, you know, without having the backstory, without knowing the backstory, you understand? So people are going through a lot of things. So when you see people, maybe a woman, a nursing mother, going through something like this, you can just, and let's say you don't know, maybe you feel like she's not aware of her options, you can tell her, you can inform her. You can inform her that
you that is informed.
Yes, you that you're informed. You can inform her. Don't go behind and say, this one, person you know say she no fit this one. You know, this kind of side. Exactly. So we should. That's the importance of programs like this, just to create awareness. So for you that did not know before and know now, it is important for you to create awareness. So if you see a group of people talking about things like that, you can also chip in and tell them this is what it is.
Yeah.
This is what it is. Awareness is important.
Very
It
important.
helps people to be able to get treatment, and so whatever they are going through, the PPD, the depression doesn't escalate.
Yeah, thank you so much, Belema, for joining me on today's session. So we'll definitely be seeing more of your face. Yeah. We'll be seeing more of you. So thank you so much for those of you that joined live on this session. Thank you so much. So if you have any question, you can drop your question. So even after this video, yeah, so you can drop your questions and we'll see them, then we'll attend to them. Thank you so much. So I hope you join me next week on Mental Health Talk with Evelyn. Yeah, so you join me next week Wednesday, same time, same platform. So you can also watch these videos and previous videos. So we have on our YouTube channel, we have a lot of videos, very educating videos on mental health that you can watch. We also have Love and Mental Health. Yeah, so it's a monthly program. We have Love and Mental Health, and we have question and answers with Dr. Debbie. We have Mental Health with Evelyn, and other educating and enlightening videos on mental health. That is very, very important that you know those things. So thank you so much for watching. Like I said, if you have any question, drop them down in the comments. I'm going to see them and I'm going to reply to every question. So if you have a question for Belema also, you can drop and signify Belema, this question is for you. So she will also answer them. So thank you so much for joining in. Thank you for watching. I'm actually seeing some familiar names. Thank you. I hope this is helpful. So do have a lovely day. Enjoy the rest of the day. Bye bye.